is Aoife Nic Shamhrain, and I am a BMS menopause specialist. When we think of menopause, we often think of all the commonly known symptoms that many women struggle with: sweats, flushes, anxiety, mood swings, sleep issues. The list goes on. However, I feel it's extremely important that we think about some of the more silent conditions that also start around the time of menopause. In a way, menopause is an excellent time to take control of your health and to help ensure that you are the healthiest that you can be as you age and move into the time in your life without the hassle of periods. There are 4 main areas: bone health, heart health, sexual health, and brain health that I'd like to speak about. When we touch first on heart health, women are 6 times more likely to die from heart disease than breast cancer. The risk increases as you lose the protection from estrogen as you go through menopause. And in fact, women after menopause have 4 times the risk of heart disease than they did before. There are plenty of things that you can do though. Treating blood pressure and diabetes reduces risk. Stopping smoking, reducing obesity, improving diet and undertaking regular exercise are key lifestyle measures. Estrogen and HRT appears to have a protective role in heart disease prevention, especially when started in women below the age of 60 and within 10 years of the onset of menopause. The second area is bone health. Declining levels of estrogen is associated with a decline in bone mineral density. 1 in 2 women will break a bone after the age of 50. And on average, women lose up to 10% of their bone mass in the first 5 years after menopause. So what can you do? It's important to look at the calcium intake in your diet to ensure that you get adequate vitamin D exposure or to take supplements, to look at the amount of weight-bearing exercise that you do, and obviously to try avoid falls. Smoking and excessive alcohol intake should be avoided as well. DEXA scans are recommended to all women over 65. HRT causes estrogen levels to increase, and this can help prevent the bone loss and reduce your risk of developing osteoporosis and of having a fracture. If you already have osteoporosis or are at high risk of bone breaks, HRT can help strengthen your bones and make fractures less likely to occur. The third area that I'll talk about is sexual health. Many people don't realise that you can get pregnant still up until the age of 55, and therefore it's worth speaking with your doctor about what your contraceptive options or requirements are. Even those with premature onset menopause have a 5% chance of spontaneously ovulating. Many women experience many genitourinary symptoms, including vaginal dryness, painful sex, frequent urination, and recurrent UTIs. Many effective vaginal moisturisers, lubricants, and of course vaginal estrogen products exist, as well as the excellent outcomes from help from our valued women's health physios. So it's definitely worth reaching out and asking for help. Reduced desire or libido is a very common complaint and can be due to so many different reasons. Many myths around sexual function during menopause also exist, which is really not helpful and discourages many women from seeking help. In some women, testosterone can be prescribed for low libido, usually after the typical conventional HRT has been tried and vaginal dryness has been treated. The final topic today is brain health, and unfortunately the main takeaway point here is that research is significantly lacking. We have 3 main large randomised control trials looking at cognition in younger postmenopausal women, all showing that HRT is safe for the brain. We also know that women that have lots or severe hot flushes appear to have more issues with brain health, such as cognition, and we really need much more research into this area.